Hi.
Hello.
My name's Victoria. I'm a student nurse at SBC. I have patient Marta Yarn. May I please get an SBAR report?
Absolutely. All right, so this is Miss Marta Yarn. She's in room 529. She's an 80-year-old Hispanic female. She's a full code. She's got no known allergies. She weighs 75 kilograms and she's 165.1 centimeters tall. She was admitted by Dr. Jolly for surgical debridement of her non-healing stage 3 sacral ulcer. She had unsuccessful outpatient treatment of it, so hence why she was admitted. She has history of numerous admissions for dehydration and pneumonia. She is widowed, and she lives in a senior living apartment. She has 2 adult children. They live out of state. There's consults for the wound nurse and nutritionist to come up. She's alert and oriented. She's got some vision losses bilaterally. Her hearing is also kind of on the fritz. She can still hear you, but you got to talk clearly to her. All right. Everything else neurologically is intact. Her chest expansion is symmetrical. She's not a smoker. She has no history of O2 therapy use. She's got clear lung sounds in all fields except for some diminished sounds in the bases, anteriorly and posteriorly. She has no chest pain, palpitations, or shortness of breath. There's no syncopal episode issues. She is sinus rhythm with occasional PVC. Her bowel sounds are all present in all the quadrants. She's got no complaints of nausea, vomiting, or any kind of abdominal issues. She does have a decreased appetite that she verbalized. She's on a regular diet right now, but she'll be NPO after midnight. Her abdomen is soft, non-distended, and it's not tender. She has got some occasional stress incontinence, and she does have some nocturia issues here and there, but she's got no polyuria issues or hematuria. Right now our plan is to increase her nutritional intake of protein so that she can get some wound healing taken care of, and we're also going to give her some antibiotic here. Her vital signs were pulse ox was 92, respirations were 24, the heart rate was 88, and her blood pressure was 144 over 90, so she's relatively stable. Okay. The wound is 4 centimeter by 4 centimeter by 1 centimeter, and it's, like I said, it's a stage 3 sacral ulcer. Okay. She also has some skin complaints of having some dry, scaly skin, so she uses lotion for that. We'll keep an eye on that just to make sure that it's not more of an issue. All right. Any questions?
Yeah, so why specifically is the client receiving this medication, and what action does the medication have on the body?
All right. Based on the wound culture, gentamicin is the medication best chosen to fight the infection that's in the ulcer. Okay. And it's obviously just to try to get the dirtiness out of there and start healing.
Okay. And when should you question administering this medication? Does the medication have any therapeutic serum level? What vital signs must be monitored? Which physiological parameters should be monitored? And when the medication is being administered?
We will definitely want to monitor all vital signs. Temperature is a big one, just to kind of check for the fever issue. We'll want to check for side effects. She already has some hearing loss, but we'll want to check to see if that intensifies.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting, and what interventions must be taught for taking the medication safely at home?
Okay, it won't be given at home, so we don't have to worry about that. In the hospital, we just want them to make sure that they're aware of the side effects and the adverse reactions, and if any of those happen, to let us know so we can stop the medication and treat them.
And what are the side effects and potential adverse reactions?
There's itching, swelling, and I mean, any other sign, allergic reaction, decrease in hearing, fever, confusion, and dizziness.
And how will you know the medication is effective?
There will be repeat CBC ordered so we can check the blood cell count and to make sure that the wound is actually starting to heal, and by just talking to the patient on the way they feel generally, if it's better or worse,
Mm-hmm.
you know, and just kind of get a baseline. on
Okay.
that.
Perfect. Those are all my questions for now.
Alrighty here. Alright, so we'll go in the room. I'm gonna get some of the stuff ready here with the bag. Alright, so we're gonna be giving her some saline
Okay.
with potassium, and we're gonna give her the gentamicin antibiotic, and we'll use that as a secondary IV line. Alright, so we're gonna
Okay.
take this all out here. Alright, and first we're going to label the line.
Okay.
Alright. So the tubing is good for 96 hours.
Okay.
Alright. So I just want to make sure that that's noted. Alright. This area is sterile,
Mm-hmm.
as is this. So we don't want to touch that or have any other issues. So we're gonna pop this off. But first, when you take these out of the bag, they're always unclamped. So we're gonna want to make sure that it is clamped so it's not leaking everywhere. Okay. So we're gonna pop this off. We're gonna insert it into the bag like so. Alright, make sure that it gets in there. Alright, we're gonna prime the line out here. Alright, we're gonna make sure that we fill it about halfway. Alright, we're gonna open the line. Make sure that everything is running efficiently through the line here. And we'll start seeing by the drops coming through. Right there. Alright, so we'll stop that. Clamp this again, just to kind of make sure we get the air
Mm-hmm.
out of the line. We'll kind of flick these hubs here. Just make sure that there's just nothing kind of hang out right before them and can become a problem, okay?
Mm-hmm.
Alright. We'll prime the other line in the room. Alright, so let's go in there and talk to Miss Yarn, okay?
Mm-hmm.
Hi, Miss Yarn. My name is Kevin. I'm going to be your nurse today. This is Victoria. She's an SBC student.
Hello.
Do you mind if she follows me?
Sure.
Alright. So we're going to be giving you some fluids today. We're going to give you some normal saline, some potassium, and then we're going to give you an antibiotic for your ulcer, okay? Alright. Wash my hands here. I'm going to re-glove up to touch the patient. Alright, Miss Jordan. What's your first and last name?
Marta Yarn.
And when's your birthday?
I'm 80.
Okay. Any allergies?
No.
Okay. Alright. So we're going to go to the MAR here. Alright. We're going to verify normal saline 0.9 with 20 MEQ. Says right there. That's the correct thing. I'm going to verify the expiration date is good. Going to make sure there's no cloudiness or particles floating in there.
Mm-hmm.
We're going to verify allergies. Make sure that there's no mistake with this being ordered. Alright, that looks good. While we're here, we can double check the antibiotic, which will also be, that's the gentamicin. Look at the time. Gentamicin. We'll look at the expiration date on there. That looks good. And again, we'll verify allergies. Alright, so all that looks effective. Alright, prior to doing this, we're going to come over here. We're going to flush the line, make sure that it's still good. I'm going to scrub the hub for 15 seconds. kind of palpate the line as we push to make sure that there's no infiltration. Make sure that it's going effectively. Any pain there, Miss Shawn?
No.
No? All right. Everything feel good like it's supposed to?
Sure.
All right. Thank you. All right. So now we're going to hang this line here. All right. We're going to turn on the machine. Alright, so if you want to come on over here, I'll show you how to put this in correctly. Put it in just like so. Sure the blue goes right there. Alright, so yes, there's a new patient. So you do that. Alright, I'm going to say, yeah. Confirm. Alright. So now we're going to go to channel select. Guardrail IV fluid. We're going to go down to 0.9 in 20 kcl. I'm going to verify that that is the correct thing. It is. Alright, according to our MAR, the rate is supposed to be 125 ml an hour. So we'll go to the rate. We'll hit 125. Go to the next one. We're gonna go about 10 mLs less. Okay, because we don't want to get air in the line. So we're gonna make sure that we do this. We're gonna say like 990 because it's in 1,000. Okay. Yeah. Make sure that's all set. It appears to be good. Take our other end here. Gonna scrub the hub one more time before we hook this up. Alright. Alright, make sure that the line is open. Hit start. Alright, we're gonna watch, make sure 5 drops fall down into there, make sure it's running effectively. Alright, there we go. So now we're gonna hang our secondary line. Alright. That's gonna be the gentamicin. Alright, so we will go to that. Alright. Alright, so we got that opened. Alright, you're going to want to scan the patient's info and all that kind of stuff prior to actually administering this stuff.
Okay.
Alright, here. So once again, what's your first and last name, ma'am?
Marta Yarn,
And when's your birthday?
80.
Alright. It is not scanning, so we're just going to bypass that. Alright, that's already running, so that's all set. Now we'll go to the gentamicin. Alright, let's scan you again here. And once again, what's your first and last name?
Marta Yarn,
And date of birth?
I am 80 years old.
Any allergies?
No.
Alright, that's like so. All right, and we're gonna spike upon this line pretty much the same way. Sterile areas. Close the thing, make sure nothing leaks. Put it in there. Attach it there. All right, we'll run it through to make sure that the line is primed. With about half the thing full here. There we go. Okay. And it's primed there, going in the garbage can. You don't ever want to touch the tip into the garbage can. Just hold it over.
Mm-hmm.
Okay. All right, we're gonna hang that up. Put this here. Sometimes things fall very easily, so we gotta make sure we pick that up. All right. Now we're gonna get ready to enter this stuff in here. We're gonna scrub the hub on the top here to make sure that everything is clean and sterile. Put that in there. All right, here. We would have backflowed this prior to, okay? We would have filled it halfway, let the saline do its job. All right, so now we're gonna add, so then we're gonna channel select, go to secondary. Gonna choose here. Gonna go to gentamicin. Q to 12. We're gonna go 80 milligrams and 100 ml. That is correct. All right, we're gonna make sure we got our line ready to be open. All right, we're gonna open the line, hit start. It'll take a second to process. Make sure that that's running right. Always want to double check that the saline is lower, and then we're gonna watch for the 5 drops come out here. All right, so that's done. We're gonna give some patient education here. All right, got some info there about your antibiotic. If you
Okay.
have any other questions, then just hit your call bell, okay?
Okay, thank you.
All righty, here you go. All right, hope you feel better.
Thank you.
And we also want to increase your protein intake nutritionally, okay? So we
For
can
my wound.
add the chicken and seafood and some meat just to try to get the wound healing better, okay?
Okay, I do like meat.
All righty.
Thank you.
All right, thank you.